I thought I had the flu or a chest infection. Went to see the GP first time and she said, yeah, she got the flu. 2 weeks later, I felt a bit worse and she said I'd now had a virus because of the flu. And then 2 weeks after that, I went to see another GP at the surgery and he did a blood test. And that night, I ended up with like a whole medical team in my living room about 10 o'clock at night. I was sitting right there when my consultant came in and shut the door. I thought, it's going to be bad news. She said, I'm really sorry, you've got a rare form of leukemia.
Leukemia is a cancer that starts in the early formation of the cells that make up blood. Acute myeloid leukemia, known as AML, starts in the bone marrow where new blood cells are made. It grows quickly, often into the bloodstream, where it can spread to other parts of the body. AML often has common symptoms until quite late in its progression, where patients can deteriorate rapidly. Dr Vadim Sumbayev from the University of Kent has discovered that AML cells emit a protein called latrophilin early on in their development.
If the symptoms, let's say, are not very clear or whatever, and you have something simple in your pocket which allows you to do a quick test, then it might actually increase the number of early stage diagnosis of acute myeloid leukemia or other types of blood cancer. So this is latrophilin 1. Here you see in the middle we have healthy donor, and as you can see, cells isolated from healthy donor do not have any latrophilin 1 present at all.
Latrophilin was previously thought only to be a protein used in the nervous system to transmit signals across the body and also briefly during the formation of stem cells. But using toxin from black widow spiders, Vadim and the team have found that it is present on AML cells and is used by the cancer itself to aid its growth.
Now we have studied more than 300 patients, and over 90% of them, if you take the actual cancer cells, they had latrophilin 1, this neuronal receptor, present on them. While if you take any healthy white blood cells from the peripheral blood, they don't even have traces of these proteins.
It immediately jumped into our minds that we could potentially use this protein receptor, latrophilin, as a diagnostic marker for amyloid leukemia, and also for potential treatment of it.
So this is our blood sciences department. As you can see, it's automated, it's very busy, it's very noisy. We have a number of staff working here. They're working as a team to process samples. It's a 24-hour service, so we are working 7 days a week, 365 days a year. Time is of the essence. With some leukemias, we are literally talking hours before the patient deteriorates and becomes very, very unwell. So obviously, the sooner we can make that diagnosis, the better for the patient, because the treatment will be started sooner.
Due to the aggressive nature of AML as a disease, early diagnosis is crucial to the outcomes of any treatments a patient may need to undertake. The team at the University of Kent are investigating whether they can create a diagnostic kit that could be supplied to GPs to test for early signs of AML.
Such test in itself would be very revolutionary in general. We don't have many good cancer tests anyway in the GP practice, and the blood tests that we have usually are not particularly diagnostic. They're much better used when the cancer is already known to be there and is treated, and they're much better used for monitoring. So in terms of diagnostic tests, we don't have many at all. So a test which is both sensitive and specific would be sort of almost a miracle.
It's something similar to the blood sugar test. For example, if let's say the GP has this kind of kit and no sort of special knowledge is required to perform the test, so then they do this quick test and suddenly see lateral positive cells. And they say, okay, that's fine, it may be wrong, but you need to be seen by a specialized consultant who will do further investigation, in which case more patients will receive timely treatment. So far we have developed one of the prototypes for the kit, and this involves use of gold nanoparticles. We use these gold nanoparticles as a surface, as a carrier, and we put molecules of antibodies that are specific to latrophilin 1 onto the surface of gold nanoparticle. This is how this nanocomplex looks like. It has nanoparticle in the middle like a carrier, carrying 6 antibody molecules, and each secondary antibody is labeled with fluorescent dye, which you can visualize. If you have malignant acute myeloid leukemia cell, which has latrophilin 1 on its surface, the nanocomplex, the antibody, will bind latrophilin 1 and will stay there. And as a result, 6 molecules of fluorescent dye will be lighting, will produce fluorescence. So as such, you can increase the sensitivity of the method, you can amplify the signal. When you have smaller number of cells, you see in the healthy, you don't see anything, and here you see a clear signal. When you have more cells, you see something here, and very bright signal with AML patients.
The test itself has to be rigorously tested before being used publicly, considering that any false results could have severe consequences for AML and non-AML patients.
I've had 2 sessions of chemotherapy which were designed to sort of control the leukemia, and then they're expecting me to dip quite, more severely than I have before, so my immune system will be lower than it is, and that's when they kind of predict that I will have some kind of infection which may lead to me being in intensive care again in the next couple of weeks. But they've emphasised the fact that that's not the leukemia, that's the poison they're giving me.
Chemotherapy works like, it works on all dividing cells, anything that's dividing in the body. And generally cancer cells divide the fastest, so they're the most effective. So it's a pretty blunt tool. And that's why on some types of chemotherapy people lose hair, because they're dividing cells, nails, basically anything that's continuously growing in an adult body will stop growing because it's been poisoned by the chemotherapy.
And you have all kinds of symptoms that are really bizarre. Everything from a head to toe rash that's unexplained to the sickness. My heels went black and the skin started to come away, so I almost lost my heels. And they were almost as tough as the illness I was fighting.
Latrophilin facilitates the release of another protein called galactin-9, which helps the cancer to grow by fighting off the body's natural immune response. Following Vadim's discovery, the team at the university are developing a form of immunotherapy that would mitigate the effects that traditional cancer treatment has on the body.
So immunotherapy is a bit like a scalpel, and chemotherapy is a bit like a hammer.
Immunotherapy is something which can be more efficient and have much less side effects. Rather than doing actual therapy, you direct natural human immune system to do its normal job.
So we know, for example, a certain molecule is actually promoting the cancer in the body, and we do a surgical strike, if I may use that term, only towards that molecule.
As a result, immune cells will just do their normal job, attack and kill cancer cells.
The advantage of this is it doesn't harm any normal tissue in the body. So, of course, the more immunotherapy we get, it is not inconceivable at some point we may be able to use only immunotherapy and completely do away with the more toxic chemotherapy and get the same cure rates. Hopefully that will happen in my lifetime, which is the aim that we're going for.
All the best, Maria. Look after yourself. Good luck.
I think in the future, or I hope in the future, that there won't be any need for chemotherapy. There'll be other types of treatment that aren't quite so spiteful. I would like to hope there will be other ways of doing things. That would be good. And it would be nice if I could be sure that my grandchildren would never have to go through any of this, or my daughter, or, you know, I wouldn't wish it on anybody. So that would be good, to know that one day cancer won't be this big scary thing. That's what I would like.